Hello and welcome to Labour Lens. I am Sharon Ijason. On this week's edition of the program, we're discussing about the healthcare sector and the several challenges it's faced with in Nigeria, especially with the advent of COVID-19 pandemic. We will be right back.
In order to stem rising unemployment and poverty in Nigeria, the Industrial Training Fund presented students who just completed its program to the public. Thousands of trainees of the 2020 National Industrial Skills Development Program emerged nationwide as it has concluded arrangements for the implementation of its skills intervention programs for 2021. During the event, it was noted that beneficiaries whose training commenced in the last quarter of 2020 were equipped with skills in tailoring, cosmetology, and information and communication technology.
It's a flagship program of the ITF. And just last week, this same ceremony was held in Abuja, and Director General Chief Executive was there in person. Today, we have the honor of having a representative of the DG2 for the closing ceremony. So, we are happy and we are glad that today has come to stay. And we are doing the closing ceremony for the Lagos zone. The training graduating from the 2020 National Industrial Skill Development Program in Lagos State are 105 from various parts of the state and comprise of the following trades to skill areas. We have tailoring and fashion design, 50 of them, cosmetology, 40, web design and development, 15. They have undergone 3 months intensive training through the efforts of our seasoned craftsmen who are here with us today.
As you may be aware, the NISDP is one of the numerous skills acquisition intervention programs introduced and implemented by the Industrial Training Fund in order to facilitate the achievement of the federal government's policy on job and wealth creation. It focuses on skills acquisition to create jobs, to curb the rampant unemployment, and breed a new generation of entrepreneurs in order to transform the economic landscape of the country. Since its inception, the NISDP has equipped over 200,000 Nigerians nationwide, and over 5,000 have been trained in Lagos State alone.
Yeah, I think it's part of the irresponsibility of the government. The health workers and the Frontline of the battle against COVID-19. And of course, they all have been considered as the greatest soldiers we have. Once your soldiers are defeated, once the soldiers are defeated by not being able to cater for their own family, by dying in the course of duty, and the government is not responsible enough to take care of those who are left behind, you will not encourage others to be able to stand up to fight against this attack by the virus. But when we are talking about virus attacks, we have we have deadlier attacks. From the government. That's why they have not been able to take care of those who have fought against the virus. But we have to call on the health workers, unions, to stand up, for the cause of their colleagues who have died in cause of duty, in cause of defending Nigerians. Of course, I know the ruling elite. Before now, at the peak of the COVID crisis, they could not travel. But now, since the lockdown has been lifted, there have been travel. They have been proposing for air travel. A number of them have been traveling abroad to seek a better medical treatment, including our president, who could not travel for more than a year when there was lockdown as a result of COVID. Therefore, for now, they don't care about the feelings, about the plight, about the the problem being faced by the health workers, that means that they don't care about what ordinary Nigerians are facing, because without health workers, it's not possible for Nigerians who cannot afford to seek a medical attention abroad, to secure or to have necessary medical care.
We need to do more on the area of testing. The centers should increase, and we should also make the amount for the testing, if possible, to make it free for people, so as to be able to have people that will volunteer to go freely to the centers to get tested for the COVID, so as to prevent getting to the complicated stage in their lives. And the area of infrastructure, I still want to say that the PPE is not adequate. We need more of, not just the face masks, the hand glove, the apron, depending on the stage and the individual you are involved with. All patients at this critical period should be seen as potential COVID-19 patients, because we have so much asymptomatic COVID patients in our various places.
The way you look at it, you see this rot, you see this decadence, you see this lack of motivation by the political leadership to provide good leadership. Look at the instances of the COVID-19 health workers who died while on active service. Up to today, they are still being owed the allowances and all. And this is what we have seen. And it's not just that it started with them. Of course, you know that in the period of this COVID, the medical workers went on strike about twice. It is simply because their welfare benefits were not being paid. Eventually, we were told that they were being paid a paltry 5,000 naira a month for a medical doctor. The insult in this country is too much, and so I am not surprised that people pay the ultimate sacrifice in this country, and there is very little to show for it. And this is what we are seeing with the way the government has treated our brave, our courageous health workers, and not recognizing the sacrifice that they have made to keep this country safe. It's a sad commentary on the state of affairs. But meanwhile, the political leadership on this country continue to live lives of opulence, sacking workers here and there, and yet the allowances, stupendous allowances that they have been getting for years, they have continued to maintain it. This is injustice now, this is unfairness.
On the profile interview segments this week, I will be speaking with the National President of the Medical and Health Workers Union, who also doubles as the president of JOESU. He speaks about the several challenges workers are faced with in the sector, especially the issue of being insured and also access to the AstraZeneca vaccine. We will be right back. Looking at the issue of COVID-19 pandemic that the world is still faced with at the moment, unfortunately, some health workers have paid the utmost price, which is they've lost their lives and they have families that they left behind. There are reports that some of them have not been paid insurance. The family members are yet to benefit at least a little bit for the service that they've rendered. How would you react to this?
Thank you so much. It's unfortunate that actually some of our members have paid that supreme price. And again, I want to really send my heart to the loved ones of those that we have lost. It's not a good thing to sit here to debate whether they have paid or not paid. Automatically, the government ought to have really paid. We ought not to cry for such things. But well, this is where we are. The government sometimes had said they had spent about, they approved millions or billions for insurance. From experience, those statements most times are selectively distributed. For instance, like the COVID-19 hazard allowance, where sometimes government said they have spent 32 billion, all right? But at the time they made the first payment or second payment, we detected that they have short-paid our members, which they duly agreed July 7 that we should provide them the details, which we provided. And this about, in all the months, if all put together, if they have corrected it, about 3 point something billion. Till date, Those monies have not been paid to our people, to our members. Yet, from the initial 20 billion that government said it provided for COVID-19 allowances that ought to have taken care of the 3 months, the initial 3 months, it has risen to 32 billion from what they announced. But our people, the amount owed our people, the short payments of 30% and 40% is yet to be paid to our members. So when they say they paid so much money in insurance, they know who they have paid selectively, it's usual. They may have paid those they want to pay. They may have paid those they feel are the only ones that are relevant in the health system.
So are you talking about the medical doctors? Because we know that in a sane environment, it takes the health workers, nurses, pharmacists to have a conducive work environment in a hospital or in any facility. So I don't understand. Can you be clear about this?
Certainly, like I'm saying, if they say they have paid people, all right, maybe I cannot speak for the doctors. If they have paid them or not, they would be the ones to say. But to the best of my knowledge, my members, a large chunk of my members have not been paid. Maybe if you have a chance to chat with the government, the representatives of government, they should be able to tell you who and who they've paid, if they have paid the shortfall to those who ought to benefit or not. And so the issue of insurance, the people, if you have gotten from the source that people have said they have not been paid, that is very correct.
Okay, so moving forward, we are aware that we have access to the AstraZeneca vaccine. How have your members been reacting to this? How many of them would you say have been able to get access to this vaccine?
To be very candid, I won't be able to give you the statistics, the data on that, because rightly, as a union that organizes, or as unions that organizes the personnel, we would have been involved in the various committees. And if we were part of those committees, then I would have gotten that latitude of having the data, all right, to inform you. But as I speak, we only try to encourage our members from taking the vaccine so as to protect themselves and their loved ones. We are doing that. But to say X number have been vaccinated and X number have not been vaccinated, I think that is out of my own knowledge. Pitch. So
what will be your expectations moving forward?
Moving forward, I think we've been saying this for a long time, and since they have paid deaf ears to it, that involve us in all the steps. Sometimes they will say, just in their zeal to divide and rule, they will now say, okay, instead of calling unions, the registered trade unions that are saddled with the responsibility of doing or talking, workers' welfare, they will now say they have called professional associations. And when you go down, how many professional associations have they called? Most times you see they have called just maybe 2 or 3. Whereas we have over 40 professional associations in the health sector. And then you go and call few, 3, and then say you are going to discuss health matters. And that is one of the reasons why the health system will remain what it is.
During the course of the previous year, the union went on 7-day warning strike. Can you bring us up to speed if the demands that was made have been met?
I'll tell you clearly, the result is neglect, denial. They've done nothing as far as I'm concerned. For instance, we even shortened our request list from 16 or over 16 items to 5. Said, take these 5, deal with these 5, and then I think we can have a better, environment to really discuss other things. But I tell you, these 5 issues like adjustment of CONHES, the payment of the shortfall of COVID-19 special allowance, hazard allowance, the payment of withheld salaries. Especially more annoying is the fact that those withheld salaries in FMCO were due to loot everywhere. Are things that we answer the call of this federal government, that we should help them fight corruption. We should help them reduce or remove corruption from society. And my members patriotically heeded to that call, blew genuine whistles. You know, between that time to now, if these whistles were not genuine, definitely they would have come back to prosecute some of my members for false information or misleading information. But the information we gave and my people gave was very genuine. Yet, for all these years, my people have been denied salaries of various number of months, between 4 to 7 months. So it pains my heart, and it pains everyone, that you are recruited to do a thing. You responded to that call, and you have been punished. And the same government again today is telling the world. The same government comes to say, oh, so people went on strike, and I have secured a waiver of no work, no pay. But the people they invited to come for a fight for them, to save the health system, my people went into that engagement because we felt we have a duty, a patriotic duty, to change the narrative in the health system. And the punishment is a result.
So now that the demands have not been met, is there any plan towards probably holding a NEC meeting to reevaluate the situation on ground and to know the next line of action?
Yeah, certainly we are going towards the picking our drums and the drumsticks to beat the drums of war until the tragic event that befell Joes, which is particularly my union, where my Secretary General, the wife and the daughter were lost in a ghastly fatal accident. So that actually slowed down. For instance, like we have rolled out, Medical Education have rolled out 90 days of money, we're still counting. So that actually took the steam off our intentions, and coupled with other, issues that came up through. But particularly the issues of, nonetheless, soon, maybe the drums will be beaten, especially in Enugu.
Yeah, that brings us up to the issue at Enugu, where you said earlier on that you're having some issues with them. What can you bring us up to speed on what the issues are, especially as regards the CONHENS, which is the payment? Has it been implemented in that state?
When we talk about discrimination, that is the height of discrimination. Provocative, highly provocative. In the same health system, the Enugu state government choose to pay. You see, when we talk about our rights being denied, people would always say maybe we are envying our brothers, the medical doctors. No. We are only stating our pains. We are in a family. The Enugu state government has decided to implement CONMES, which is for the medical doctors, fully. But to the CONHES earners, who make up about 80 to 90% of the workforce at that level, all right? They have offered only 10% implementation. And when the people said no, give us something better. If not, even if not the 100, you gave some people 70 or so before, and now you've taken it to 100%. Why not push us to this point? Rather than doing that, threats, intimidation, victimizations, and all the rest. Anyway, we as a people that believe in a dialogue, exhaustive dialogue, we actually sent a letter to the Enugu state government that will be expecting them to resolve these issues. We gave them 30 days window. They promised inviting the national to a meeting and then the state so that we can resolve the issues. I think the National Secretary was called and he was told so. But from then to now, it's getting to, that 30 days expired and we have gone through another 30 days. And they have not. So recently we have decided that we give them 15 days ultimatum. The other one was just, in a very strong belief in dialogue, we gave 30 days window. It was not an ultimatum. We are giving you this period. Please try and see how we can resolve this issue.
So what's your message to the government of Enugu State?
I would want to tell Enugu State government that they should seize this opportunity of peace to resolving the issues. Or else, the national will come. They know what we used to do when we are provoked to this level. If they have not known, then they should call other state governments that have tried this, that have gone this path. We will storm Enugu, and nobody will stop us.
Okay.
Joesu will storm Enugu.
Okay. That about that, unemployment seems to be the rise in the day, and we know that the healthcare sector can also provide more job opportunities for the youth and Nigerians at large. Now, would you say that we have enough health workers in the country?
Not at all. This is a country of, by the available statistics, is over 200 million, right? Mm-hmm. And I do know that we have less than 3 million health workers. Far less than. As I'm talking about both public and private sector. All right? So it's grossly inadequate. And although, and again, that there was an embargo on employment for a long period. So the available health workers are also aging. Lots of them have retired. And the replacement is not commensurate, even though they have given some level of, some small percentage of replacement opportunities. The replacement is not commensurate with the exits. And that is why today you have one health worker doing the job of 6, 7, or 10. And that is really telling on our output. Because a fatigued health worker, you can't get 100% from such a fatigued health worker. So, if we really want to keep this country moving well, health-wise, and health is important, and it is the wealth of the nation. So, I think the government will do a lot to employ more. And that brings me to where our argument that also increase the work years. Retirement age to 65 and then 70, as the case may be. All right? That's why we are saying so. So that you can still get some of these ones, the old hands, to be retained in the service, to also mentor the young ones that are coming from behind, that you may be recruiting. Because there's already a gap. There's already a gap. So for these new ones to mature into this, you have to keep these people going. And again, our length of training is so long. For that reason, we cannot, allow a situation where you just keep the years stagnant, because most will not even rise to the peak of their training, the peak of their service rather, before they finish their training. And that's one of the reasons. And also when you have given to other sectors within the same civil system or civil service system, why do you deny us? So that's why we are saying that they should do it fast, so as to, bridge the gap. Just bridge the gap and allow the experienced ones to stay. And come to think of it, even the advanced countries, some people argue that so that younger ones can come, can be employed. In the universities, it is 65. In judiciary, it is 70, 65, 70. Are they not still employing there? They're employing. And is it the younger ones you employ today, are they coming to take up the positions of the seniors? No, not directly so. And again, I want to ask, if one of the most sensitive jobs in this country, all right, in any country, in any given country, for you to be a governor, is tasking. Presidency is tasking. All the beings in the Senate, they are tasking. And even to be a judge, have tasking, it is. So the mental work there, load of mental work there. So if, for politics, for instance, even at 100 years, you are still qualified to be president of the country.
So finally, you're saying that you want the relevant stakeholders to look into the retirement age of health workers?
Urgently.
Urgently.
Urgently, yes.
Thank you very much for your time.
Thank you.
That's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.